I'm Dr. Jeff Smith, and I'm going to explain how to use the PTC Therapy Laser today. First, I'm going to talk a little bit about the equipment itself and the packaging so you can understand some of the technical details for operating the laser. It comes in a carrying case. The carrying case has an extendable arm. It's on wheels so it can roll around, help you get into and out of the barn. Some equine people like to put it on a cart or use their ultrasound cart, so that is fine to do also. There are locks for these, but I don't typically use those, so you have to unlock those to open the case. And then this is the way I like to have the case organized with the laser in use sign, so that is a requirement that you do have a laser in use sign, and if you have it here in your box, that's fine. I usually will give you access to those signs so you can print up one or two extras if you like and put it on your card or put it on the outside of the box, but have at least one in use. When you look in the box, these are your 3 safety glasses, and it's important to have them in the box this way. If you put them in this way, then this little hanger gets caught when you're trying to close the door, so put the hangers towards the back and the zippers towards the front. You have 3 sets of glasses, 2 of these over-the-glasses types that are made for people like me that already are wearing glasses, so you don't have to take them off. And they go thusly. And then there's one of the what I call Bono style glasses, and those are a little more stylish, but they're for people that aren't wearing eyeglasses, and that looks like this. Typically when I'm using the laser, I will remove the plastic, and the only thing I leave in the carrying case, and again these are the Bono style ones. And do remember that you can't wear Oakleys or A-bands. These are infrared protective, and your sunglasses are ultraviolet protective, so they don't really cross over. And then in this case, there's a pair of retainers, if you like, and then a little bit of information about the protection. But I will typically just leave the black cloth for cleaning the glasses and the glasses in the case. And then these you can also use for eye protection over an eye or sensitive tissue if you need to as well. So they sort of have 2 functions. Next, you'll notice that the transformer for the laser, a lot of people try to put this in the bottom of this hole, but it really works a lot easier and better if you put the power cord in the bottom and then the transformer on top of that, because when the transformer is in the bottom, it tends to get stuck and it's harder to get back out of that space. And then in this middle space is going to be the different heads for the laser. So in this box, you're going to have 4 different heads. You're going to have your small non-contact, and you're going to have your large non-contact. It sort of fits in there snugly. So let me see if I can pull that out. There we go. And then your large contact head, and you'll be using this most of the time for your musculoskeletal stuff. And then your small contact head, okay? I usually keep 1 head on the laser, and you're going to have an extra set of these heads. So you have 2 sets of 4, and you're also going to have an extra handpiece and cable. Typically, I just keep those extra pieces in a box somewhere separate, but it'll prevent you from ever being or having to go out of business for a day if you have a problem with one of the ones we have. Excuse me. So these are the blinders for the horses. Most of the time, these aren't necessary to use unless you're working up around the head of the horse. And some horses feel a little out of sorts when they're totally blinded like this. So another option is you can take some duct tape and put that on the inside of a fly mask and protect the eyes that way. Or again, the dark cloth over the eye if you're working up near the eye. The laser fits snugly in here, and the foam is cut out to fit the laser in place. I do want you to notice how the fiber is wrapped on the laser, because you want to rewrap it this way every time. And so the laser goes around concentrically until the last lap, and then on the last lap you want to make a figure 8, and then the handpiece fits into the cradle. Now the handpiece, and sometimes this will sort of bow out a little bit. You have to hold it in when you drop it into place there, but it fits in there pretty snugly and nicely. The handpiece only goes into the holder facing backwards, okay? If you try to put it in this way several times, it'll fit, but you'll fatigue this piece and it'll eventually break, and then we'll have to replace that. So Safety-wise, sort of, you want the laser handpiece pointing away from you, and like I said, it's unidirectional because this is not a symmetrical piece, so only clip it in backwards. The other thing is, whenever you use the laser, you want to completely unwind the cable. Do not leave 1 or 2 laps wound around the cable. We want the light to be following as straight of a path as possible, and so that's how we want the cable unwound when we're ready to use the laser. So when I'm not using it, a lot of times I'll have it completely unwound, and then I'll just carry a loop or 2 up to keep it from dragging on the ground, and I'm ready to go patient to patient or horse to horse. So just to show you a couple of the other features. On the bottom is the battery compartment. If that ever needs to be replaced, relatively easy to replace. A couple of vent holes on the front and on the back that you want to vacuum from time to time and prevent dust from accumulating in. On the back, there's a door switch safety, so if this is broken or is removed, the laser won't work. It's really for the human side. You don't have to worry about it. There's a foot switch port, which we don't use, and an Ethernet port, which we don't use. You will be using this small space here to plug in your transformer to charge the laser, and if the laser runs out of energy halfway through a treatment, you can plug it back in and immediately use it. You do not have to recharge it prior to using it. You can run about an hour or so of lasering, relatively high power before you run out. A USB port, that's for updating the software. If that needs to be done, you'll plug in the USB and then turn the laser on. And then your on-off switch, which you'll obviously be using quite a bit. So when you're ready to turn on, you just click that on, and the laser will take about 30 seconds or so to start up. The other thing I wanted to mention is just about cleaning the laser. You can use alcohol in a 4x4. You want to treat these handpieces like camera lenses. Keep the red caps in the ports at all time when you're not using it. If you get dust or dirt in here, it's important to clean that out so they don't stay in the light and overheat and start to smell or smoke. And then the same thing if you want to clean the handpiece, the outside 4x4 with alcohol is typically the way I do it. I do use other things from time to time, like a little simple green or some Axel disinfectant if we need to do that. So those are the basics of the equipment and the carrying case, and we'll take a slight pause and move on to the next part. Thank you. Here we go. We're going to talk about safety a little bit. I do want to point out 1 or 2 other things here. On the bottom of the laser, just make sure that the fiber is twisted in tightly, and check that from time to time. The finger switch is sort of a phone jack kind of a plug, and I have had people get that unplugged somehow. So if your finger switch isn't working, just check that that's plugged in properly and that that's finger tight. You really shouldn't have to remove this fiber, but if you do, when that tip is exposed, you want to be careful not to get it dirty or smudge it because it's so tiny that any obstruction to the light will really diminish the dose that's being delivered at the handpiece. The other thing I want to talk about is the maximum bending radius. So this curve that the fiber follows around the wrapping station, that's about as tight as you want to bend it. It is a fiber optic cable in here, so if you squeeze this back on itself, you can break the fiber inside. This is Kevlar over metal, and then that's over the top of the fiber, so it is very well protected and gives you a long distance to work from the laser. But again, be aware that it is a fiber optic cable inside, and you can't fold it back on itself. There's several safety features of the laser. So the first is that you have to know the combination, which is 1, 2, 3, 4, and then press the enter button. When you're touching the screen, use the pad of your finger plus the fingernail, and that seems to be the way the screen likes to be registered the best. Once the laser's on, you can stop it at any time by hitting this laser stop button. I typically don't do that very often because you can turn the laser emission on and off with the finger switch, and you can turn the laser off at the back. But there is an emergency off switch on the front of the laser. You'll see that you have 3 different places to go on the laser: protocols, operation, and setup. And we'll talk about where those buttons go, but I just want to let you know that you can usually, when you pick your area of operation, sometimes hard to see from one side, you'll see that the laser comes into a standby mode, and then when you're ready to operate, if you touch the standby, it'll blink 3 times and tell you that you're in ready mode. And this is mostly in the context of understanding the safety. So once the ready mode is on, the red light will be emitted, an aiming beam from the laser. So that's sort of a warning that the laser is either going to emit the therapy beam or that it is emitting the therapy beam. And then when I press the finger switch, you'll get an emission on the front of here. So now the laser is emitting laser light. So that is sort of a safety indication as well, that you have 3 different modes on here. You have emission when the finger is triggered. You have ready when it's ready to be triggered, and then when you're done with ready, you have standby. So those are typically the 3 modes of the laser that you need to understand: standby, ready, and emission. So those are basically the safety features on the laser as far as turning it on and off and knowing when it's on and off. The other thing is that the laser will emit sound when the laser is actually engaged in that emission mode. So you'll hear a constant beeping sound. Occasionally people ask me about the beeping sound changes. It's usually going beep, 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 and then sometimes it goes beep, beep, beep. And that is either when it is changing frequencies or pulsing, or when it would have. So if you choose to keep the laser in continuous wave, then it'll still make that noise when it would have changed frequencies, and sometimes that throws people off a little bit. So just understand that anytime the laser is making noise, it is emitting the infrared beam, and you need to be aware of that. And when it's not making noise, it is not emitting. So you have some choices in the settings menu that we'll talk about in a bit, whether you want it to be beeping or whether you want it to have a constant tone. But if it's making noise, that means it's emitting, and so you need to be observing the different safety protocols at that point. Okay, so we're ready to take another pause, and I'll be back. All right, a couple other safety things I want to mention as well. One is doing laser therapy in a safe location. So just be aware that light is reflected by shiny surfaces, metal in particular. If you happen to be doing laser therapy on a stainless steel table, you want to cover it, or if you have jewelry, you should remove it. Definitely be wearing the safety glasses to prevent secondary reflection. And if you have a group of people, you want anybody not wearing eye protection, say you're in surgery, to be more than 4 or 5 feet away. Ideally, the laser therapy should be taking place in a room, and anybody or a stall, anybody in that room or stall or that direct area should be wearing eye protection. When you're using the contact head, not a lot of light is escaping from the tissue, and you'll sort of get a sense of this later on. When you're using the non-contact head, there's definitely more reflection happening, and so again, more chance for secondary escape of the light from the tissue, the intended tissue. Okay, so I want to talk a little bit about the contraindications, and that sort of also speaks to the safety issue. So definitely do not want to be administering laser light into the eye of an animal or person. The reason is that light will get focused through the lens onto the retina, and you'll get a retinal burn. Light gets into the eye from different angles when you're doing oral therapy. You're really not going to have any problem. It's more of a direct approach through the lens into the back of the eye that can cause a problem. And again, if you're doing small animals, you want to be wearing the safety lenses that have the infrared information on the front for which wavelengths they protect against. Again, ultraviolet protection, like any regular sunglasses, will not work. And that's also true of the glasses that the people wear. They need to be infrared protective. And again, the wavelengths in here are 808 and 980. So you want your eyewear to indicate that they're protecting for those particular wavelengths. You don't want to laser over any active bleeding. The laser does cause some vasodilation, and so if you have active hemorrhaging, you can actually make that worse. So, I always think of like a tooth that you removed and the alveolus is hemorrhaging, you can't get it to stop. That is not a time when you want to laser that. Once the bleeding is stopped, if you have a little oozing, then lasering is fine, not a problem. You can do it intraoperatively. It is also not a problem. You can do it on a post-operative hematoma. So all those things are okay, but when you have active bleeding, especially if you're having a hard time getting under control, do not laser that tissue. And then the third strong contraindication is for neoplastic tissue, so tumors or growths, especially if you expect them of being neoplastic. And the reason for that is we don't want to stimulate cancer cells. You know, we're stimulating other cells in the body to do their job, and we don't want to stimulate cancer cells. Now, having said that, I do, and I know many veterinarians will laser, say, an osteosarcoma dog that you need to get some palliative pain relief or edema relief from. And those dogs don't suddenly get worse. That tumor doesn't suddenly get bigger. So the contraindication of not applying the laser to cancer is more theoretical than based on a known fact that we're going to be stimulating a cancer to get worse. The other time that this does come up is if you happen to be doing a cat that has, you know, IBD and you're not sure if it's if it is early lymphoma or not. And so again, ideally you should have a biopsy, but have that discussion with the owner. And perhaps you have a similar case where you're not sure if you have cancer or not. The best result there is to get a biopsy and know before you do the lasering. There's also some contraindications, mostly based on jurisprudence, meaning that, you know, we don't want to have to prove that the laser didn't do some harm. So that includes testicles, ovaries, implanted devices like pacemakers, fetuses, over corticosteroid injections, or over epiphysitis. And those are slightly weaker contraindications, and again, I think that that's a more case of jurisprudence where we don't want to have to defend trying to prove a negative that the laser didn't do some harm. Okay, we'll take another break. General therapy protocols, and I want you to have a little bit of an understanding of what the laser is doing for you. So the software in the laser makes it really easy to come up with dosages for the conditions that you're going to treat. And those are starting points, and especially when you're first using the laser, you can pretty much stick to what the laser tells you to do. But as you become more expert and proficient, you know, you may want to vary from what the laser is telling you. Either deliver the dose more quickly, or deliver a higher dose, or deliver it to a slightly bigger or smaller area. So again, I think as your knowledge and experience with the laser increases, your comfort level will grow. But you should understand when the laser comes up with a dose, you know, where is it coming up with that dose, and how is it coming up with that dose. So the two basic conditions that we treat, or two different depths, are superficial and deep. When we're treating superficial conditions, and I include anything that I can see the pathology, so, you know, scratches, or a wound, or an incision, any kind of dermatitis, those are going to be treated at typically 3 to 4 joules per square centimeter. And so an easy way to sort of work that math out in your head is to know that your hand is about 100 square centimeters. A 3x5 card is almost exactly 100 square centimeters. And so if you're doing 3 to 4 joules per square centimeter, each handful of tissue is going to be 400 joules. So if I had a wound that was 3 handfuls big, then I would be doing 3 handfuls at 400 joules per handful. That'd be about 1,200 joules for that area. When we are talking about the area that we're treating, also remember, we're not just focused on the area of the tissue with the pathology. I really want to do an equal area around that pathologic tissue because of the blood supply and the typically inflamed nature of the tissue that's associated with the injured tissue. So when you calculate those dosages, you want to be looking at an area that includes the normal tissue surrounding the injured tissue. For deep pathology, we want to be giving somewhere around 10 joules per square centimeter. In horses, a lot of times we will use up to 20 joules per square centimeter, especially for backs. So again, if you use that 100 square centimeters as your handful, or a 3x5 card, and you're giving 10 joules per square centimeter, that's about 1,000 joules per handful. So if I did my knee's about 4 handfuls, that'd be about 4,000 joules. If I wanted to give 20 joules per square centimeter to my knee, that would now be 2,000 joules per handful. Again, 4 handfuls times 2,000 joules can be 8,000 joules to treat my knee if I want to use 20 joules per square centimeter. Where this is particularly helpful is if you're treating a horse's back, say, and you have a dose of 26,000 joules to administer. Sometimes it's hard to understand or to sort of break up how big of an area you need to administer that dose over. So again, if you were delivering 10 joules or wanted to deliver 10 joules, that'd be 26 handfuls if you're doing 26,000 joules. If you're doing 20 joules per square centimeter, then it'd be 13 handfuls. And typically when I'm doing that, I usually break it up into quarters. So if I had 26,000 joules and that was going to take me about 25 minutes, I'd be thinking 5 or 6 minutes per quarter, and I would treat that quarter, and then I would move to the next quarter, and then to the next quarter, and to the next quarter, and that would be done. So you can do this any way that you like, but that typically works for me pretty well. Take a break, talking about general treatment principles, and I want to talk about the heads that are available to use. So anytime we're treating those deep pathologies where we're going at 10 to 20 joules per square centimeter, we want to be using our contact head because we're going to get 90% better delivery of the photons to the deep tissue. We have less reflection, we're compressing the tissue, and we're also blanching the tissue, pushing the fluid and the blood out of the tissue. So at those deep reaches when we're trying to deliver that therapy, we always want to use the contact head. If we can't see the pathology and the animal will let us do it, in other words, they're comfortable enough to use the contact head. The bigger heads, the two large heads, can be used with any power setting from 0 to 15. The little heads are constricted because this small contact head we want to use with 6 watts or less, and the small non-contact head we want to use with 3 watts or less because we have a lot of power coming through a little space, and if we put more power through that, then we'll end up getting too warm. Even when we're using this small non-contact piece, say on a small wound or in the ear, you want to, again, make sure you're not vibrating it back and forth. You want to be making full excursions onto and off of the damaged tissue because as that tissue warms up, it will cool down again, whereas if you're holding it vibrating over the same place, you'll sometimes create some discomfort, and the animal will usually let you know. And there's another thing I'll tell you is it's valuable to let the client have a sense of what it feels like to have their own tissue laser, just so they're not worried about what the animal is sensing. So a lot of times when I get ready, I'll say, hey, do you want to just see what this feels like so you know what the horse is going to be feeling? They feel it, and you can just see them relax. When they hear laser, they think laser, they're thinking, Star Wars and cutting, and sometimes they're a little worried that this could be damaging or uncomfortable for the pet. So again, usually once they feel it, they're very reassured that it's okay. In fact, the danger is that they'll want you to do their neck or back or elbow or something like that. So again, you have to weigh the pros and cons of letting the owner get treated, but really letting them have a sense of that the first time when you do it, I think, is important because it does give them a good idea of what the sensation that the animal is feeling. The 3 conditions that we treat sort of overall are basically post-procedure, acute, and chronic conditions. Those are 3 groups you should have a pretty good sense of in your brain. The laser will tell you how much energy to deliver each time you're doing the treatment, but it doesn't tell you how often to do the treatment. So for post-procedure treatment, say after you've sewed up a wound or done a dentistry or something like that, we only treat the site 1 or 2 times, and mostly that's in the context of multimodal pain control rather than accelerated healing. It's really not going to change how fast the wound heals, but make the horse feel better, immediately and give you some pretty good analgesia for 24 hours. Acute conditions, again, could be a wound, some dermatitis, an acute strain or sprain. Typically, those will get treated 3 to 6 times, and those will be healed, and you won't have to treat them again. Sometimes that could be a little bit longer, and those we can treat daily or every other day. Again, it sort of depends on the schedule and what the owner can do, but acute conditions can be treated more acutely with some benefit. There's really no benefit to treating twice per day, but there is a benefit to treating daily versus every other day when you have a really acute inflamed condition. And then we have chronic conditions, and those take 12 treatments is what I tell people in most cases, and sometimes you get lucky and it takes less, but 12 treatments every other day. So that's 3 times a week, Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, for 4 weeks, and that's called the induction period. Then once a week for a month, and then once a month for maintenance. that will vary depending on what other medicines you're using, how chronic the condition is, if it gets acutely inflamed with a show or some kind of competition. But those are three, overall principles that you should be following for post-procedure, acute conditions, and chronic conditions. And the chronic ones are the ones that tend to be the biggest challenge, and sometimes you really have to have some patience for, especially if it's a very long-standing injury. It's going to take you in that up to 12 category. If you tell clients it's going to take 6 to 12 treatments, the problem is that they hear the 6 and then they're disappointed when it takes 8 or 9 or 10. So I tell them the induction period is 12 treatments. If we get lucky and it's less, fantastic, but let's plan on 12, and here's the schedule we're going to follow. Also, if a client can't do Monday, Wednesday, Friday for whatever reason, that's ideal, but you could do, Monday, Thursday, Friday, or you could do Tuesday, Friday, Saturday. So if you got those 3 treatments in per week, even if they weren't ideally spaced, you're still going to get a strong benefit from that. And likewise, if you have an owner that's really motivated and wants to do daily treatments of these chronic conditions for the first week or 10 days to get it going, then that's certainly all right to do as well. Okay, we're going to take another break.